Hello, this is Dr. Stanley Lang, and welcome to this broadcast. The topic is on weight loss tips and focusing a little bit on the ketogenic diet. And I had a patient encounter today that kind of made me think about this as a subject. The context for what we're sharing is a whole person health approach to being well. And of course, we're focusing now on physical aspects of that with the ketogenic diet. But I believe that true wellness, true health involves health of body, mind, and spirit. And I'd like to encourage you to kind of think about that for a moment. Now, I was talking to a patient today that has had several years now of trying to overcome her weight issues. She's, like many people, gone up and down, has never really fully embraced my usual approach, which is what I call the modified plate diet, which is a low glycemic diet that I developed in the 1980s. So it's been around for a long time. And it's somewhat similar to what has later been called the paleo diet, which developed later than this particular diet. And it really works very, very well. But for this particular patient and for many others, it doesn't work because they can't get over their cravings for their favorite foods. They just can't make that shift to this way of eating. And so I was thinking about this person's difficulties and a few other patients that have had success by switching their direction completely. So with the ketogenic diet, it's not similar to anything that any way of eating that most people are eating, at least, because with the ketogenic diet, you're turning almost 180 degrees away from the average American diet. Whereas when I have people follow my usual low glycemic diet, most of the foods they can still eat, but some of the foods they have to keep out. But it's close enough to the way they usually eat that for some people, it's just too tempting to go back to eating the high glycemic foods. High glycemic foods meaning foods that are converted to sugar quickly. With the ketogenic diet, we completely turn the chemistry around so that we're relying on fat for most of our fuel. And this diet has been around for a long time, over 100 years, was initially used for pediatric seizure disorders, and now is sort of been resurrected in the last 10 years or so and is being excitedly used for a lot of different medical indications. But the point that I was making in this case is that sometimes you have to do something that's totally different than what you were doing to be successful in making a big change. And that way you're so far turned away from the usual approach that you've been following that it's actually easier to do, even though the ketogenic diet you would think would be harder to do. But for some people, it is so different, it's actually easier to get started on it and to stay on it in the long run. So if you're having trouble getting started and staying on a low glycemic diet, which is literally critical to long-term safe weight loss, then consider the ketogenic diet as one version of that. Now, I have some resources to do it safely because most ketogenic diets are not completely safe. And I haven't reinvented the wheel. I just have some resources that make sure that you're getting a few critical nutrients that are often missed when people do the ketogenic diet. But other than that, it's a very powerful and safe way to have good health and to have rapid weight loss. So I wish you well, God bless, and have a great day.